Good day, Philippines.
The first one is D, which stands for danger. Always check the danger to you, any bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when going to the assistance of another person. Next is response. Check if the person is conscious. If they do respond when you talk to them, touch their hands or squeeze their shoulder.
Are you okay, sir? Sir! Sir!
Next is S. Send for help. Call the ambulance and don't forget to answer the questions asked by the operator.
Call 911, please. Call 911.
Next is airway. Is the person's airway clear? Is the person breathing? If the person is responding, they are conscious and their airway is clear. Assess how you can help them with any injury. But if the person is not responding and they are unconscious, you need to check their airway by opening their mouth and having a look inside. If their mouth is clear, tilt their head gently back by lifting their chin and check for breathing. But if the mouth is not clear, place the person on their side, open their mouth, and clear the contents. Then tilt the head back and check for breathing. And next is breathing. Check for breathing by looking for chest movements, up and down. Listen by putting your ear near to their mouth and nose. Feel for breathing by putting your hand on the lower part of their chest. If the person is unconscious but breathing, turn them onto their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing until you hand over to the ambulance officers.
Ano nangyari?
Sir, 5 minutes ago, nakita ko siya nagbabasketball, then bigla siyang hinimatay. Chinek ko yung breathing niya, hindi normal, and until now, unconscious pa din siya.
CPR, cardiopulmonary resuscitation. If an adult is unconscious and not breathing, make sure they are flat on their back and then place the heel of one hand in the center of their chest and your other hand on top. Press down firmly and smoothly, compressing to 1/3 of their chest depth, 30 times. Give 2 breaths. To get the breath in, tilt their head back gently by lifting their chin. Pinch their nostrils close. Place your open mouth firmly over their open mouth and blow firmly into their mouth. Keep going with the 30 compressions and 2 breaths at a speed of approximately 5 repeats in 2 minutes until you hand over to the ambulance officers or another trained person, or until the person you are resuscitating responds. The method for CPR for children under 8 and babies is very similar, and you can learn these skills in a CPR course.
Sir, okay ka lang? Sir?
And in this part, defibrillator, for unconscious adults who are not breathing, apply an automated external defibrillator if one is available. They are available in many public places, clubs, and organizations. An AED is a machine that delivers an electrical shock to cancel any irregular heartbeat in an effort to get the normal beating to respond itself. These devices are very simple to operate. Just follow the instructions and pictures on the machine and on the package of the pads as well as the voice prompts. If the person responds to defibrillation, turn them into their side and tilt their head to maintain the airway. Some AEDs may not suitable for children. Puncture wound. Hole in the skin that usually goes through all layers of the skin. Laceration, a cut that tears the skin and may also involve damage to the underlying tissues. Burn wound are caused by overexposed to thermal, electrical, radiation, laser, or chemical agents. Avulsion, known as skin tear, a deep break to the skin, tearing it away from the underlying tissue. Just follow the following instructions. Number 1 is wash your hands. This helps avoid infections. Number 2 is stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean bandage or cloth and elevate the wound until bleeding stops. Number 3 is clean the wound. Rinse the wound with water. Keeping the wound under running water will reduce the risk of infection. Number 4 is apply an antibiotic or petroleum jelly. Apply a thin layer of an antibiotic ointment or petroleum jelly to keep the surface moist and help preventing from scarring. Number 5 is cover the wound. Apply a bandage, rolled gauze or gauze held in place with paper tape. Number 6 is change the dressing. Do this at least once a day or whenever the bandage becomes wet or dirty. Number 7 is get a tetanus shot. Get a tetanus shot if you haven't had one in the past 5 years and the wound is deep or dirty. Number 8 is watch for signs of infections. See a doctor if you see signs of infections on the skin near to the wound, such as redness, increasing pain, drainage, warmth, or swelling.